All right, well, good afternoon, and thank you for joining us for our monthly National Consortium of Telehealth Resource Center webinar. Today, we're going to be looking at health and education, talking about how telehealth breaks down silos. If you're not familiar with the Telehealth Resource Centers, there are 14 total telehealth resource centers funded by the Health Resources Services Administration. We do function together as a consortium. We've been doing that now for about going on 4 years. We are 14 individually federally funded resource centers, but we just realize that when we pool our resources together, we're a much stronger organization. You can see here we have two national organizations, the Center for Connected Health Policy, or CCHP, and then we have the Telehealth Technology Assessment Center, and then the remaining 12 telehealth resource centers are regional. I'm the director of the Southeastern Telehealth Resource Center, and we are hosting today's webinar. Just some tips and notes for you guys as you participate today. Make sure your phone and your computer has been muted. You are going to be able to post chats in the chat box, so please ask your questions. We want to make sure that we get your questions answered. If we do not reach your question today during the hour, then I encourage you to reach out to your local telehealth resource center. So please fill out at the end the post-webinar survey. There will be a slide that'll have a link there. So we encourage you to do that. That helps us out as we continue to plan for these monthly webinars. So the webinar is going to be recorded. So you will be able to access that later through the link here that you see, youtube.com/c/NCTRC. You can also go there and find some of the past webinars as well. Just to go ahead and introduce our speakers, it's going to be sharing today, Ms. Loren is the Director of School Health Plus with Global Partnership for Telehealth. And then Ms. Jennifer Murphy, she is an account manager for Global Partnership for Telehealth and works very closely with Loren on the school-based telemedicine, and then also works a lot with our universities as they have really been kind of coming on as far as education goes. So with that, I am going to actually stop sharing my screen, and I'm going to pass it to you, Loren, and let you kind of take over.
Thank you, Lloyd. If you guys will give me just a second so I can get my PowerPoint pulled up. Okay, are you seeing it?
Absolutely, we are.
Wonderful. Well, I want to thank everyone for allowing me the opportunity to come and talk to you today. I don't know how many of you have ever heard or talked with me before, but as you can probably tell from the Southern accent, I am from Georgia. I won't apologize for it too much. I hope you'll be able to bear with me and understand what I'm saying as we're talking about this important topic today. A little bit about my background really quickly, because I think it is pertinent and relevant to what we'll be discussing today. I am a registered nurse here in the state of Georgia, and for 14 years, I actually was a school nurse in a small rural South Georgia community. And the last 5 of those years, I was blessed enough to have telehealth as a part of my school nursing clinic. I was actually the first nurse in the state of Georgia to try to implement and create such a beast. And I did it very well. I did it for 5 years before I then joined the GPT team. And now I'm able to help schools all across the nation with trying to figure out how to implement school-based telehealth programs. So I'm thrilled to be with you guys today. And I want to talk a little bit about how telehealth really is an effective tool for breaking down the silos that exist. So I guess before we really get going too much into it, we really need to ask the question, are education and healthcare actually standalone entities? And I will think that most of you who are familiar with either one of those would probably say yes. Each one speaks their own language. Each one has their own sets of rules and regulations that are, have a lot of governance, a lot of rules, a lot of things that have to be followed. And they're quite unique. Education speaks its own little talk. Healthcare has its own burdens and other things that have to go on too. So many times when you cross over into this world of school health care, it's hard for people on either side of that fence to understand the language and understand the what needs to happen in order to surround school health appropriately. So understanding that there are some gaps, within the two entities, and then figuring out how to cross over. Now, being a school nurse by trade, with my history, I will say that I think a school nurse's role is pivotal in having good communication flows between these two entities. So they have a really good grasp of the healthcare system, obviously, one foot in that silo, and then the other over in the educational world. And I can tell you, in my 14 years within a school district, I learned a whole lot about education, and I was really able to help both sides communicate effectively. And I think we were really able to surround our students in a way that met their educational needs as well as their healthcare needs. Now, a lot of times I hear school districts that will say that they're not in the healthcare business, they're in the education business. I like to always argue the fact that I think they would probably say they're not in the transportation business either, and yet most school districts will transport their children to and from school. Most school systems will say they're not in the restaurant business, but yet they feed their students often breakfast, lunch, and sometimes supper, depending on some after school programs. So I understand they're not a healthcare business, but yet healthcare still has to be addressed within these educational systems. And I know it seems like an added burden. Their primary role is education, obviously. They are worried about test scores and rankings and the state qualifications and, all of these things that have to happen. But in order for those things to happen and happen successfully, they have to consider the health care of the students who were enrolled in that school. You're actually on the front line for providing some of those preventative health care services, as well as, any of the other things that come their way when it comes to health care. Nearly 50 million United States children are enrolled in public school systems. So they're spending the majority of their days sitting in those desks, walking the halls within our school systems. 10% of those students who were enrolled in our public schools are medically underserved. They don't have insurance, or they just have limited access. I know in my small hometown, we don't even have a pediatrician that is here in our town. So you're having to travel, 30 miles or so to get to healthcare. There are a lot of really small rural areas that don't even have a hospital or an emergency room. Thankfully, we're seeing some of the emergence of some of the centers that will have more of those urgent care needs that can be met. We're seeing some of that, but telehealth has really served to help increase that access to appropriate health care. We know that of those 50 million kids who are coming to school, at least 15% of them are coming with pre-existing medical conditions. We've heard a lot about pre-existing medical conditions in the last little bit, with everything going on with COVID and politically as well. But these children, even without COVID and without politics involved, they're coming to school, and the schools have to be able to effectively help manage their care and take care of them so that the education can actually happen like it's supposed to. So we got a good majority of those students that are, really needing some support and needing some help when it comes to healthcare while they're in school. And despite all of that, every single one of the children who are coming to school, every one of them need that physical and emotional support. They need help with any kind of chronic diseases that may happen, management of those things while they're in school for those 8 hours out of the day or more. Sometimes they get sick and they need help with those kinds of things. So we really have to consider the importance of health care within those school walls in order for education to really make sense. This is going to come as no surprise that health impacts education. We've known this for years, that children must be present in school and must be engaged in order to effectively learn. I used to have a little email signature at the bottom of my emails that said children must learn to be healthy and must be healthy to learn. And that's very, very true. Students with chronic absences, and that's defined as missing 10% or more of the school days, are very much more likely to become dropouts. You can read some of those statistics there about the dropout rates and stuff. It's just astonishing how much those absence rates correlate to the dropout rates. So we've got to do something to try to address those that are chronically absent. Some of these things, the reasons that they're chronically absent is because of the asthma and the diabetes or sickle cell, seizure disorders, all of these things they're impacting these students. And if they're not well managed and it's happening during that school day, they're going to be sent home, and that will absolutely negatively impact attendance. Even if they're not sent home, if students are sick and they're not feeling well, they're not learning. So we're having some issues with that too. I thought the last bullet was really interesting. A 2014 study in the Journal of School Health found that there is actually a really true effect of health on standardized testing scores. So, we have sometimes it's hard to find that data, and I always try to encourage any of the schools that we partner with who are doing telehealth to really try to pull some of this data. Before telehealth is implemented, what are your testing scores? What are your absenteeism rates? And then after telehealth is implemented, are you seeing a difference in those things? And maybe not in the first year, but within the first 5 years, are you seeing some trends towards that? And if you do pull some of these data reports, please publish those, because there are those of us who would really love to see and have the proof that these things are actually impacting education in a very positive way. So we know that health impacts education, but we also know that education impacts health. We know that people with lower levels of education have worse health than those with more education, even if they both have the same access to care. So it's not really an access issue at that point. So you have to wonder, what is it? Well, we know that prevalence of diabetes was 15% higher for those who did not complete high school, as only compared to 7% for those who were college graduates. Those more than 25% of adults without a high school diploma were smokers, and only 8% who did have a college degree. So adults who don't complete high school can expect to live years fewer than those who are college educated. Now, that is a surprising statistic. We do know that education does impact your health, but I did not realize until I was doing some of this research quite the significance that education does play in the role of health. So both health and education, both of those impact society. Obviously, those downstream effects of education and the reading, the math, the cognitive skills, they're all going to influence population health. They're going to influence social determinants. I know, as an educated person that does have a college degree, I have a quite difficult time of navigating the healthcare system at times, and I'm sure many of you have had the same experiences. I can only imagine what it would be like if I couldn't read, or if I didn't understand what the question was even asking me. And certainly when you start talking about some of these healthcare lingo and all the diagnoses or the treatments that are going to be done, people are scared of that and they don't understand. So it definitely, if you don't have a good education, you're going to have a harder time navigating the healthcare system. They also, a lot of these folks with the lower levels of education are going to have those riskier activities, the riskier behaviors. They're going to have a harder time navigating this system, and they're not going to really have the quality jobs, which perpetuates those social determinants that impact our population health. So we really have to see that health and education cannot be silos. While they are distinct entities, we have to figure out a way for both of them, because they both impact one another. So we have to figure out a way to make this stuff work. So what can impact health and education and tear down these barriers between them? My argument is school-based telehealth all day long. Having been there and done it, as I mentioned before, that school nurse and your school health team having the knowledge of the school environment as well as the knowledge of the healthcare environment, they are the conduit to make sure that information is flowing appropriately between these two, to surround these students and their families with the appropriate healthcare steps that they need in order to make them have the most successful education experience possible. So that's the ultimate goal. And I think that school-based telehealth is a wonderful bridge between both of these two entities. So I want to talk just for a second about some school-based telehealth goals that we often see. Now, keep in mind, I'm not actually doing telehealth anymore, but my organization with GPT, we do go and help other school systems, and we always ask them, what are your, based on what your needs are within your community, within your school district, what are the goals that you're looking for to accomplish by implementing telehealth? And the majority of the time, most of them just want to increase the access to that quality medical care and appropriate. So if you don't have, whether you have a healthcare provider on every corner surrounding your school district, or whether you have none, sometimes those students cannot get to those providers for care. So just because there is a high prevalence of providers in your area, it may not necessarily correlate to those students being able to go to that provider to get the care. If you implement school-based telehealth programs, students who are at school during those 8 to 10 hours out of the day have access to quality medical care right from the facility. So that is the number one goal that we see that most of our schools are trying to reach with doing school-based telehealth. Another one is to provide some of that needed healthcare service for some of those chronic diseases that we mentioned before that are negatively impacting attendance rates and some of that stuff. I have specifically seen a big push towards reaching those asthmatic students who may not be well managed. It's kind of some of that low-hanging fruit in schools. And I can promise you, if you speak to any school nurse anywhere across the United States, that they will all say that asthma is a huge, huge element that they have to deal with their student populations. No matter the area, no matter the age, asthma is extremely prevalent. And a lot of these students are not receiving the maintenance care that they need. Many schools do not have inhalers on hand for these students. And in my own experience, when I finally would get an inhaler from a parent brought to the school for the student to use, it would be a long-acting inhaler that was 3 years expired. So I know I'm not alone in that plight. And so asthma is a really, really good topic to try to reach and try to impact with school-based telehealth, being able to connect those students in with a healthcare provider to get those maintenance meds on board and to decrease those exacerbations is huge. Another huge area we're seeing is with the mental health realm, and obviously that's a big buzzword right now. Obviously with COVID going on, but even before COVID hit, mental health is a huge need. It is a need that is trying to be addressed by schools, and they're doing a much better job of it, but we have a shortage of mental health providers in many areas. So telehealth has proven to be a very, very beneficial thing to try to incorporate with your telehealth models within your school districts. And then any other identified school health issues. I've been mentioning a little bit about COVID, but very recently, GPT did try to assist some schools in trying to figure out a plan for how telehealth can actually, boots on the ground, help with students and these school systems trying to deal with their COVID mandates and trying to keep these students healthy, but in school at the same time. I know a lot of school districts may still be doing all virtual models, but there are a good number who are doing in-person and maybe some mixed modeling of in-person and virtual. Regardless of the model, students are still having health issues. Students still need mental health. Students still need some asthma care. They need maintenance. And so telehealth has been a wonderful way, whether students are at home or if they are in school, for telehealth to really serve and step in and help out with making sure these students are taken care of. We actually have one school district in South Georgia that is taking this virtual telehealth school-based nursing telehealth model a little bit further. Their mandates state in their school district that any student who is experiencing any symptom of COVID whatsoever, whether it's a headache or a little bit of a sniffle, or even if they sneeze one too many times, obviously everyone is frightened, and so they're sending these students home. They must be home for 14 days unless they have proof of a negative COVID test while symptomatic and a doctor's note clearing them to return to school. They have inserted telehealth into this model, and now these students are, if a school district has a CLIA waiver and they're able to get their hands on some rapid COVID testing through the telehealth clinics, then they can obviously go ahead and do those rapid tests. They could possibly go ahead and get that negative COVID test, completed, as well as have some medical providers there that are able to say, yes, this student is fine, the lungs are clear, we don't think this is an issue. That may just be some allergies, or it may just be something else that's, you know, non-COVID related. And it's keeping these students where they might only miss 1 day of school as opposed to those 14 days. So it's really proven an effective tool during this whole COVID outbreak, and with these school systems trying to come back together. Another big goal that we're seeing with school-based telehealth is for these school districts and their communities to assist families with overcoming these barriers to healthcare, whether those be transportation barriers, lack of access barriers, all of those things, to really surround. It's a time for the community to pull together and really try to help not just students, but their families as well. And we've seen a big push for that. We've already mentioned before about the decrease in the absenteeism rates and the early dismissal rates, and then hopefully improve those test scores. That could be a goal of your school-based telehealth program. And then just to extend the traditional school health services. You know, a lot of schools across the United States have school health programs in place. Many have school nurses in place. While the roles may vary slightly from state to state or even district to district about what that school nurse is able to do, all nurses are limited to a degree. We can only do so much without having a healthcare provider coming behind us and giving orders and helping that student out. So this is a great way to just extend those services that are normally present within schools around their school health programs. I will tell you, having helped several school districts try to implement telehealth, it is not a simple process. So if you have it in your mind that this is going to be an easy thing to do, and it is not. There are so many, as any other telehealth program, those of you who are not in the educational world or any of that, it's a difficult thing. And when you're talking about school telehealth, you're throwing even more into this, because you're talking about educational folks who don't always understand that healthcare lingo again. So it's really important that that school nurse help kind of with the flows and cycles. I've never just seen a school-based telehealth program just stand up on its own and just be easy. It really requires a lot of planning. Go over those goals. Know what your community's needs are. Know what your students' needs are within your community and within your school district. You know, what kind of healthcare providers do you have readily available and are able to partner with the school? You need to go through all of these things before you ever implement or before you ever get your first piece of equipment for telehealth. Those best practices, there are tons and tons of school-based telehealth programs out there. There's no need for you to go and try to reinvent the wheel. I would suggest that you reach out to some that are already doing it and say, hey, how did you do it? Let me learn from you. And you'll be surprised the information that you're able to glean from folks who have been there and done it and can provide some really good best practice guidelines for you. I think it would be remiss if I did not mention that it's important to use those quality telehealth tools. While there are models, and we've seen, especially around COVID, where it's more of the direct-to-consumer models, you know, where it's just more the video interaction between the student and school nurse and provider, you know, it's important in a lot of regards to still be able to do those full exams. I am a nurse, and so I always hold to the belief that a telehealth visit should be as good as a visit in person to a provider, if at all possible. So we do encourage our school districts to implement great exam scopes and tools so that those providers can see eyes, ears, nose, throat, skin lesions. We also recommend that schools utilize stethoscope capabilities so that as the school nurse is listening to a student's heart and lung sounds, that the provider can also hear those on the other end. I've mentioned before about tracking the measures and doing some data collection. That is crucial, again, in order to increase the sustainability of these programs, in order to prove the worth and value, hopefully get some funding, more funding for school-based telehealth. We've really got to do a better job of tracking some of our data that surround both health and education. You really need to try to engage people who are willing to go the extra mile. We call these the telehealth champions, as most of you are aware. They're hard to come by, but I promise you there will be folks who are willing to go above and beyond, and that's the folks that you're going to need in working your school-based telehealth program and supporting your school-based telehealth program. I really encourage those of you who are trying to implement school-based telehealth to recognize that whole child, the whole health concept, that while your telehealth program, one of your goals may be to reach asthmatic students, as we mentioned before, don't let your blinders inhibit you from being able to provide care for maybe some other health care needs that arise. Start small, but be willing to grow. You need to think about the whole child and how you can support them at both the school district level, healthcare level, and the community level. So I like to use an extended team approach when we're coming to providing this kind of care. This is one of our models that the majority of the schools that we partner with use. Now, this is going to look a little foreign to some of you who are familiar with school-based telehealth, but this is, again, the way we've seen it, and this was the way my clinic worked, where the school clinic, where the school nurse sits, is the hub. That is the center of care. That's where the student is. And then through telehealth, they're able to connect with as many of the local providers as are available. Maybe it's a pediatrician, a family medicine provider, a local hospital, local health department, anybody that is available within your community and within your area who is willing to connect back in with you to provide those telehealth services. It is a wonderful thing. Then outside of that, if you need to branch outside of your community, this is a wonderful way to then use telehealth to connect to these remote specialists that maybe be in a larger city nearby, or a remote specialty center, so that you can really try to surround that student with the needs that are there. It's a wonderful thing because it doesn't neglect one provider. Everyone has a chance to participate and be a part of this. It really puts the student as the focus, not the healthcare provider as the focus. It puts the student at the focus and not necessarily the school as the focus. So it's a great way for us to all wrap around. So that I encourage you to, if you haven't thought about this model, to look at it. Now, I will say this, I think you have to have a strong school health team in order to do this model, and we'll talk a little bit about that in just a minute. Another really interesting model that we've seen develop over the past year or so, and more so, is the telehealth hub and spoke school-based health center model. So this would be where you have an on-site school-based health center provider, where an outside healthcare agency, usually either the local hospital or an FQHC, community health center, they actually come in and set up camp and set up a clinic within the school. It is owned and operated and run by that outside healthcare agency, but it just happens to be on school property and able to treat students, staff, and everybody there. Well, this is great, and that is a wonderful, wonderful model to have. However, I hope you can see the limits in that, because while you have an on-site school-based health center at one location, what about all the other schools in that district? Are they able to have the same access to care? Most of the time, no. But with the implementation of telehealth in this model, suddenly you've expanded the reach of that on-site school-based health center to now they are the hub to spoke out to the other schools within the district. It's a great way to make sure all students within that area are able to have that access to the quality care that we had mentioned before. And of course, with it being in the school district, if the student did need to go in person, it's usually a little bit easier to get them transported over there. Outside of this, whatever that on-site school-based health center is not able to accomplish, if there are needs that are not able to be met with the current staffing models that they have or what is available within their entity, then they can use telehealth likewise to go out to these specialty providers, to these remote, distant healthcare providers that are able to really fill in those gaps that might be missing there. So it's a good way. We just need to make sure we're trying to, not oust any medical providers in this model. We still want to make sure that students are appropriately seen and taken care of, and we're just thankful that we have school-based health centers that are willing to do that. I mentioned to you before that I think it's very important to have an extended school health team approach. Obviously, your student team is crucial and critical and must be at the center of all of this and everything that you're doing with school-based telehealth, whether you're a hospital hoping to partner with your school system and implement school-based telehealth, or whether you're the school itself, whether you're a community entity and you're wanting to do this. The student team must be at the center of this. with a student, obviously number one, and then thinking about the parents, grandparents, or other guardians that might be there. But I want to mention that the school team is equally as vital. So that would consist of obviously the school nurses or clinic aides, school counselors, and school social workers when it comes to those mental health aspects that are needing to be addressed with telehealth. And then obviously the partnering providers. They have to be, while they're outside of the school and are not actually a part and employed by the school system the majority of the time, they must be considered a part of the school team. So this is where we're starting to really break down some of those silos and barriers where we're kind of cross teaming here, where those providers actually become a part of the school health team. In addition to that, I have a whole bullet full of other, a list of folks here that we cannot forget. So, you know, it takes every one of these folks that are listed over on the other side of your screen to understand the role of telehealth within schools, to understand the needs that are facing these students and how we're trying to help really reach and accomplish the goals that we're trying to, you know, we've set with our programs. And it's going to take every one of these to be an included part of the school health team. I encourage folks to hold advisory meetings as often as you can and include some of these folks. You'd be surprised at the knowledge and input or resources that these folks may have available and are willing to help really wrap around these services for these students within a school district. Now, obviously your medical team. None of this could be possible without your medical team. So likewise, how I said before, with you're talking about your healthcare providers that are outside of the school district, on your medical team, those school nurses and counselors and social workers need to be counted as part of the outside entity's medical team. So you have your local primary care providers, you have your local pediatricians, you may have some remote acute or primary care providers that are needing to be a part of this. Your local hospitals, do you have a local health department that's willing to partner? Local specialists, and then anybody outside, if you don't have any local specialists available, that you've identified a need within your school district and you need to reach out and try to figure out how to provide those services for those students, then go outside of your area and use telehealth to do so. And then obviously your mental health providers, whether it be psychiatry and the counseling piece, I think both of those are equally important when it's coming to wraparound services for mental health for our students. Lastly, I want to talk about the community team. So while we've talked about the student team and the school team, the medical team, we also have the community that we need to think about, because this really has to become a community-driven effort in order for these to be successful. So whether it's your family connections or communities in schools, DFACS, DJJ, any of your employers, your industry leaders, because you're helping your communities, your chambers of commerce, civic organizations, churches, these folks that you're helping. Remember, your ultimate goal probably is to reach students and really help wrap around services for healthcare with them. But in the process, you're helping families. And in the process of doing that, you're really trying to affect some of those population health issues and really kind of start changing some mindsets, changing some things. And it's going to impact positively on your community. So with your employers, you're going to hopefully try to keep these parents at work. They can connect in, join in on the video call between the student and the provider, but then those parents can do so maybe while they're on break and not having to leave. And it's really important for those families whose parents work hourly wage jobs and then maybe they don't have sick leave and time that they can take off. So it's a really good benefit for those, and employers love to see this. We've actually had some communities where some of their large employers actually help support the school-based telehealth program because they've seen such an impact that it has had on their own employees, not having to worry about their children, and they know that they're taken care of and getting the help that they need. So it's really important to try to pull in all of these folks and see, again, it takes some ingenuity to figure out how to pull these folks together, but the most successful school-based telehealth programs that we have seen have all tried to use this team approach and pull everybody together at the table. Just like this picture shows. So, you know, it's a puzzle trying to figure out school-based telehealth and figuring out how to help the needs of these students you know, I may have an answer for one thing, you may have an answer for another, but if we can pull everyone together, whether it's the community, the medical community, the schools, each one of us has a piece of the puzzle that we can put on the table. We can all try to put in what we can. And if we're willing to all be telehealth champions and do this, then we're going to really provide for these students and do a remarkable job with it, and have a really successful school-based telehealth program. I have a few references there that will bore everyone to death. Before I go into the next slide and turn it over to Jennifer, I do want to mention one other area that telehealth we have seen used within our school-based telehealth programs. When not in use providing actual medical or mental health services, some of these schools have decided to try to implement and incorporate telehealth within their educational setting. So in the school health science classes, what used to be health when I was back in school, those classes are really doing a good job of trying to make sure their students that are in the classroom understand and know about telehealth, since this is happening right now and it is a part of healthcare. It's not the future and hey, this is something you might want to be aware of for later. It's something you need to be aware of now. So they've tried to implement some of these, at least a little bit about telehealth into the curriculum at the high school levels in some of the schools that we've worked. Now, I'm going to turn it over to my colleague, Jennifer Murphy, who will talk to us about how that has now grown from the K-12 setting over into the college world. Jennifer?
Thank you, Lauren, and hey, everyone, and thank y'all all for having me today. So when I joined GPT, I was working hand in hand with Loren with the K through 12 school systems and meeting the needs of those and training, and I still work very closely with Loren, but I have taken on telehealth in the college setting. So that's what I'd like to talk with you about today. Now, I am still learning as I go, so if I don't have the answer, I can help get the answer. But I'd like to share with you some ways that telemedicine is currently being used at the collegiate level. So I would like to start with student health services. So most colleges already have a student health clinic on campus, and they're already seeing college students for their health needs. So why not add telemedicine to that? You're still able to offer the same services such as acute care, chronic care needs, counseling, follow-up appointments, but you're able to do that at a distance now. So you can still see those students in person in that student health clinic, but you can also fit in these additional appointments through telemedicine and see these students from a distance. So to add to that, now with telemedicine implemented in your student health clinic, you can expand and offer additional services such as specialty care. So endocrinology, pulmonology, psychiatry, cardiology. I mean, there's so many different specialties, you know, that can be offered through telemedicine, and you're able to present if you're set up for a presentation site or an originating site, then you would be able to present these students for those specialty care needs. So with that, if you're acting as a presenting site and you have all of the things that Loren was talking about, a lot of time with these specialty visits, you're going to need additional tools on your end, like the Horace exam scope, which is a extremely great camera to have for like Loren was talking about earlier, the ears and the throat and all of that good stuff, and then the stethoscope to you know, listen to those live heart, lung, and abdominal sounds. So when you're presenting, depending on the state that you're in, you can bill that presentation site fee. So you could check with your regional TRC about the billing, about billing that original site fee. As, like I said, that varies from state to state. So if you are able to bill this originating site fee, that could obviously help sustain your telehealth program within the Student Health Services Department. And we do have, GPT has partners, college and university partners that are currently doing this, and it is working very well for them as far as implementing telemedicine into their student health clinic. So now I'd like to dive into a ready workforce. GPT was already in K through 12 school setting, which includes some health classes, just like Loren was just talking about. At the high school level, GPT was already in provider offices, helping providers connect with their patients. So when we were going in and helping these providers get ready and set up for telemedicine to offer that service to their patients, we noticed that there was definitely something lacking. So GPT quickly realized that there was some training that needed to happen between that high school level and that professional level. So we identified that that was a need, and so we're going after it. We want to help our colleges and universities learn more about telemedicine. We want to help our health field students to gain that comfort and education that they need to be ready to enter into the workforce and be ready to implement telemedicine within their practice that they move on to. So anyways, that leads me into what we're talking about, workforce readiness. So there was a huge spike in the use of telemedicine since the recent and ongoing pandemic, which is an approximately a 4,400% increase according to various studies. Y'all, telemedicine, I don't believe is going anywhere. It's here to stay. So we might as well just buckle down and learn it. Get our hands dirty. Let's learn how to use it. Let's get comfortable with it. So what are we doing to help prepare those in the medical field for the workforce? So let's talk about a few things that can be done. So in your skills labs, hands-on training, just like with those tools that Loren and I were just talking about, your stethoscope. Are you comfortable with using a Bluetooth stethoscope and sending those live sounds? How do you know how to use that stethoscope? The Horace exam scope, are you good at focusing in on images? Are you able to see those images well? So if you're in nursing school, you definitely need to be practicing with that Horace exam scope to learn how to focus well, take really good images so that diagnoses can be made correctly. The knowledge of the telehealth hardware. Are you comfortable with using a telehealth platform? Are your students familiar with a telehealth platform? Have they seen one? Before I started with the GPT, I was a community coordinator in my local where I live, and I served as a liaison with the healthcare system, the public school system, and also local providers. And there were several in the medical field that had never seen telehealth stuff. Like when I'm going around and training these providers on how to use a telehealth platform and showing them images that can be taken from a distance and sent to them live, they're amazed. So you probably may not have or run across too many providers now that haven't had some sort of experience with telemedicine, as COVID has kind of forced telemedicine in our direction, and people are, looking to implement that. So anyway, again, between the high school level and the professional level, we need to fill that gap and educate our health field students, whether that be nursing, med students, PAs, F&Ps, speech path, behavioral health, and things like that. So are you comfortable with a platform and the use of that? Are you comfortable with the use of hardware, telehealth hardware? Are you implementing any sort of educational modules for your students to learn more about telemedicine, what it is? There's a difference in telehealth and telemedicine. What's the difference in that? So all sorts of things that you can learn, like the billing. Billing is a huge thing. We want to make sure that when you leave from college and you're in your professional field, that you you know what to do about billing. And so anyway, you know, just look to, let's see. So these educational modules may be offered by your regional TRC, the telehealth platform company that you're using, like Global Partnership for Telehealth. They offer these, and so does your telehealth platform offer educational modules? And just look for educational opportunities altogether, like webinars and things like that for your students to learn from. All right, so lastly, I'd like to mention clinical hours for the upper grad students, mainly for the upper grad students. This is an area that GPT is continually trying to help in and make connections between our colleges and providers' offices. So when the pandemic hit early this year, there were so many health facilities that pretty much shut down to outside students, and we're not allowing those people to come in for their clinical hours. We had college partners that were like, you know, we need some help getting our students some clinical hours. I literally had a professor to call me and say, I have a handful of students that only need 10 more hours, but they couldn't get them because they weren't allowed into these facilities. So GPT, you know, starts researching and trying to figure out how can we help make this happen, you know, because we definitely want people to be able to graduate on time. You can't graduate without all of those hours. So we work to try to make those connections with the colleges and willing providers that will allow students to connect in via telemedicine. And you know, there's several platforms out there that you could use, and the one that I know is Pathways, which is offered through GPT, and it has the feature where you can add a person to a call. So while you're in a consultation, so let's just say that your student is connecting in for clinical hours to see a patient that they have partnered with a health facility, and so they're helping to see these patients just as they would if they were actually there physically in person. So they can connect through telemedicine because there's a link that is sent out. That patient can join that link, and then if the professor needs to join that call to observe that appointment, or if the provider needs to join that call to help with the situation with the patient, or to help move that appointment along for the patient needs, then there's an add a person. So that student can invite you know, people to that appointment. So your professor can be in one location, your student can be in one location, and your doctor can be in one location, and your patient can be in one location. So we're all in different locations, all connecting in one place to meet the needs of the patient. So that is something that we are, you know, that we constantly are working on and consistently working with our colleges and healthcare professionals that are in the network to try and make those connections and help gain those clinical hours. So I know I'm very brief today, and I apologize for that, but these are really, and I talk a lot with my hands, so I'm sorry about that also, but so these were the 3 points that I really wanted to talk about. So student health services, you know, what are the needs of the students on your campus? So if you're just only needing to meet acute care, chronic care needs, follow-up appointments, is telemedicine implemented to help with that so that you can see these students from a distance? And COVID has put us at a distance. So in some cases, you don't have the option but to do appointments at a distance. Workforce readiness. So are our healthcare field students ready when they leave college? Are they ready to implement telemedicine within their facility? Because telemedicine is huge. I mean, it's here. We used to say that telemedicine is the future. It's no longer the future, it's the present, and it's only going to grow from here. So what have we done to prepare our college medical work, student base for the workforce and in their professional lives. And then clinical hours. So, you have to gain those clinical hours, in college to be able to graduate. So, are you having trouble finding ways for your students to gain those clinical hours? So telemedicine can meet the needs of so many different things in the college setting. And I think that's all that I have. I appreciate y'all for having me. If you have any questions, please let me know.
Yep. Thank you, guys. Thanks, ladies, very much. Lauren and Jennifer, appreciate you taking your time and being with us. We do have some questions in the chat box, but Lauren, first I'd like, if you can, to go ahead and bump on to the next slide, just
Sorry. Yes, I will.
Or, I mean, I can pull mine up if you need me to. It doesn't matter.
Sorry, I jumped ahead.
Do you have the slide with the...
There it is.
Yeah, there we go. All right. So, yeah, I mean, as we kind of go through these questions, if you'll please just help us out by doing the survey here. Completing this survey, it'll gives us great feedback, kind of on how we're doing, and it also gives us ideas for upcoming webinars as well. So Lauren, there are, and Jennifer, there's a few questions. As a community hospital that serves as the receiving end care, for providing care to a college telehealth student center, we're working on tackling the addition of CLIA-waived lab to enhance the testing options as a complement to our telehealth program. In regards to billing, does it make more sense for the health center to have this function or have the hospital maintain the billing as part of the telehealth visit?
Okay, so I know that I'm knowledgeable about CLIA-waived testing in the K through 12 setting, and I would assume that it is very much similar in the college setting. No?
Well, I'll speak it to this. With it being a college clinic and having the provider remotely in, there may be a way for that college clinic to bill for providing that test service. So that's what you're going to need to look at according to your state's regulations and your guidelines around billing and getting reimbursements for these types of services. I know that in Georgia with K-12, when it comes to CLIA-waived tests, school systems and school telemedicine clinics can absolutely obtain CLIA waivers, and we encourage them to do so. But when it comes to the reimbursement piece for the school districts, while the test must be done at the school location where the CLIA waiver is, the provider cannot bill for that service. So, but neither can the schools. And so that's one of those things we're really pushing for in Georgia, to try to get as a covered reimbursement cost for our school districts, but right now it is not. So check with your state's organizations, your insurance providers, to see if those tests can be billed from the student health center. If so, then do them there, get that CLIA waiver test there. But regardless, your CLIA waiver must be on file where that test is performed. So you can't have a CLIA waiver that covers that provider, but the test be done at a different location in order to bill for it, if that makes sense.
Okay.
I appreciate that.
How does your telehealth program address students who are overweight, obese, with diabetes or other chronic illnesses?
So it's going to depend on the school district and what their goals for their telehealth programs are. Again, we just kind of help get them set up, but it's up to the school districts and their partnering providers on how they want to tackle some of these topics. I know that a lot are doing some of the screenings for the the obesity and the healthy eating and all of those kinds of things. You may do some group work. We have some of the school districts who are connecting with their community specialists, like especially for the students with the diabetes management. So they're connecting in with that student's healthcare provider and doing some of those follow-up appointments from home. The testing that may need to be done, if it's A1Cs, if the schools don't have that on board, then the provider would just simply, write the script and the parent could go get it done, and it would be ready and on, on hand at the provider's office when the telehealth visit does happen.
And talk a little bit about parents. One of the questions is kind of where do parents stand? You showed a couple of models. You had more of a where the school was the kind of the hub, and then you had kind of a model to where you had maybe a healthcare entity as the hub. But I think both would probably, the parents probably are going to play the same role in both. So just kind of talk about where the parent stands in that.
Well, when we go in and we're helping schools get these set up and their communities and their healthcare providers, we cannot stress the importance of keeping those parents in the loop. These are their children. They have a right to know about the healthcare that's being done. We encourage all of our schools to incorporate enrollment packets for those students that would include history, physical, telehealth consent, insurance information, you know, all of those things that are vital and important. The parents, the role of that parent, and those need to be updated annually. The role of that parent can't stop there though. So before every telehealth visit that is scheduled from the school district, we encourage these schools to reach out to those parents via phone, text, email, so, you know, the approved communication. Make sure those parents are aware of an appointment, have given consent for that specialized appointment, and then you're following up with the parent afterwards. In a lot of the cases now with some of the different telehealth platforms, as Jennifer mentioned, there's the ability for that parent to link in and be a part of that telehealth visit. And so we encourage that as much as possible. You cannot do this without the parents. As I mentioned before, as that extended health team, that parent is a part of that student's health team. I mean, you cannot do this with the exclusion of the parents. And I think that's where some of the school health programs that I've heard about in the past historically, you know, have had a hard time keeping those parents in the loop, and parents are not going to want to participate in a program where they don't know what's happening with their students and have a role, have a say-so in the care that their kids are being provided.
Okay. In the chat box, in your opinion, does telehealth in schools require an on-site school nurse?
My opinion, yes, because I very much advocate for the role of school nurses, but I know that it has been done and can be done outside of that. We have a couple of different schools that use us as, you know, our help with their programs, and they have actually implemented and hired a mobile telehealth nurse. So where there may be a clinic aide at maybe, you know, 5 or 6 schools, and one school nurse kind of covers that, they have a telehealth nurse that once whoever is responsible for the health care at that school, whether it's the school nurse aide, whoever, if they identify a need, think that there needs to be an appointment that is taken care of with a healthcare provider, then that floating nurse then gets the call, she steps in and comes over and does it with, you know, kind of a mobile unit, if you will, in order to make sure of that. So we have, you know, different ways, different things that are happening in that arena.
How about, have you seen efforts around improving health literacy of students to help them with their health outcomes? So
well, I would
Go ahead.
Sorry. I would certainly hope that is happening. I know that we have some of our schools who have partnered with some of their literacy programming. They've actually done a combined effort in order to get their school-based telehealth programs in order to reach some of those health outcomes and education outcomes that we had spoken of before. So I know it is being done. I don't have specifics on that since, you know, we're not actually boots on the ground in these schools. We're just helping the other school districts do it. But yes, I think it is a very important thing. And in order to help break some of these cycles, we've got to address the health literacy as a part of this.
And Loren, do you have any of the data on the relationship between education literacy and health literacy? I mean, do you have any data on that? And that may be something we can throw out to the consortium.
Yes, if y'all can do that, you know, as I had mentioned before, in all of my research over the years of trying to, in doing these presentations and you know, going and talking to schools, I really try to stay on the forefront of a lot of the research and data that's out there, but unfortunately, there's not too much out there. But maybe it's just something I haven't seen. So if any of you are aware, of course, I would love for you to share that information with me as well. And I think that's something that we all need to do a better job on is sharing some of that data.
So we've got about 1 minute. What's the experience with nurse practitioners utilizing telehealth in conjunction with school-based clinics?
So yes, the majority of our schools who are doing this are primarily connecting with nurse practitioners who are, overseen with providers, medical providers, MDs, DOs, those kinds of things. Jennifer is working, with several of those NP programs at the collegiate level to try to get those folks ready. Because yes, and again, according to your state and what your laws are, but we're lucky here and in most of the areas where we work, where those nurse practitioners are able to get good reimbursement for doing telehealth.
All right. Well, that brings us up to our hour. Thank you everyone for joining, and we will try, Nathan, I'll try to get you an answer to your question on the literacy data. So thanks ladies for your time. We appreciate you very much.
Thank you.
Thank you.